Good evening, Los Angeles. This is a tough moment in our world, in our country. But here in Los Angeles, these past 10 days have been especially difficult. The hottest day ever on record in our city. And now outside, our air is choked with smoke. We see an orange sky, an obscure sun on too many days. And we see this week the places and spaces that we call home, that we know and that we love, have a tint, a fiery glow that makes them look like scenes from another planet. COVID first kept us in our homes, and now throughout California and the western states of this country, so many of our neighbors have had to leave those homes as fires come near and threaten their lives. We've lost souls, we've lost firefighters, we've lost homes, and for many people, they've lost hope. COVID led us all to wear masks to protect from the spread, but now we're wearing them to help us breathe through the ash that hangs in our sky. But even in the midst of the latest challenge, we do what we do here in Los Angeles. We continue to help one another, to find a way to dig deep, to find that extra gear, to keep going, and to make sure that we protect everything that we love here in Los Angeles and in this world. This past weekend, we activated 4 smoke relief centers at Rec and Park facilities here in Los Angeles to provide residents reprieve from the unhealthy skies. We've sent our fire crews, who are on the line right now from the Los Angeles Fire Department, to help just here in our backyard battle the Bobcat fire in the Angeles National Forest, which as of right now has burned 44,393 acres and is at just 3% containment. Other firefighters from our city are further north in 10 different fires where they're on the front lines protecting communities who last year sent their fire departments to help protect our communities when fire came to the edge of Los Angeles. All told, we see in our state more acres and more destruction than any year in our recorded history. We are feeling the immediate impacts of climate change and facing challenges that demand our commitment to the long-term solutions that it's too late to reverse the warming for, but to mitigate the impact in our communities and throughout the world. Our unflinching determination to reverse this devastating new normal year after year after year. But this year has not given us the luxury of fighting one crisis at a time. And while we fight these fires, we continue to fight the ongoing fire of COVID-19 in our communities. Since the day this coronavirus arrived here in Los Angeles County, our top public health goal has been keeping infections low enough to make sure our hospitals have the capacity to serve any patients who are worst hit by COVID-19 and any other maladies they face. That's not only the job of our medical personnel and our first responders. We've learned it's the job for all of us. Each one of us in our communities and our homes, our places of work, have that immediate work to do where we aren't just passive bystanders, but active lifesavers every day. Yesterday, I and Supervisor Catherine Barger met here in Los Angeles with the United States Surgeon General, Dr. Jerome Adams, to share the lessons of our response here to the pandemic, the testing centers we stood up, the nursing facilities where we demanded tests and cut deaths by more than 80%, the success in eliminating the racial health disparity among African Americans in Los Angeles County in the face of COVID-19. And when we were asked what more we needed, we both asked him to take this message back to Washington, that Angelenos, Californians, and Americans are counting on the federal government to deliver financial support to those local governments and first responders on the front lines. Those workers in the hospitals, those firefighters transporting people, folks that every single day are putting their bodies and their lives on the line to protect us. I was pleased to see a door open up again today in those negotiations, and I urge the President, I urge our Senate, and I urge our congressional leaders to come to an agreement now, put politics aside, and help our cities who are facing furloughs and layoffs, help our first responders that are saving lives get the financial backing that they need, and help us save those that are suffering the most from the economic devastation that has resulted from this pandemic. You see, threats like fires and deadly viruses call on all of us to come together across political lines and political boundaries, to support one another and to play an active role in saving lives. We are not powerless, my friends. We are powerful. When we come together and we figure out ways that we can protect one another, whether it's our loved ones or strangers in our city, we are one Los Angeles, and we are proving that each day. I've asked so much of you during this pandemic. Stay home, wash your hands, wear a mask, keep your distance, get tested. I know it can be a lot to contain or even to remember, but you've done an amazing job. Our hospitalizations from COVID right now are at the lowest level they have been since the first outbreak here in LA. Your actions have saved the lives of thousands of your family members and neighbors. That's something to be proud of for the rest of your life. But our progress remains fragile. We know that. 1 week where we let up on wearing a mask, the virus spreads. One party that should not be thrown that people attend, the virus spreads. Open things up too quickly, and the virus spreads. So tonight I want to talk to you about a new threat that is just around the corner, where I need your help one more time. I need you to do one more thing that you add to that list to protect yourselves and your family and your loved ones. This threat is the flu. Every Angelino has a critical role to play in preventing a worst-case scenario. Doctors are already talking about it. Folks from the CDC and others, Dr. Fauci, are saying this could be the worst phase of this pandemic just in the next couple months. If we see our hospitals, our community, and our economy overwhelmed and overrun by cases of COVID and the flu together, everything we have worked for could be threatened. We cannot let that happen. We will not let that happen. So I'm going to ask you to add this one more thing to that list so you can save lives and stop the spread. Now is the time for you and your family to go get a flu shot. Follow the instructions from your doctor or your healthcare provider. Visit Walgreens or CVS or Rite Aid in your neighborhood, or one of the many other locations, including community clinics, where you can get yourself the flu vaccine. The CDC recommends that everyone over 6 months of age should get the annual flu vaccine by the end of October. So we've got a little bit over a month to do this, but don't delay. Do it now. Last year, fewer than half of all Americans got a flu shot. This year, we need to get 100%. We need to do much better and make sure everybody is vaccinated to avoid the double hit of both COVID and the flu at the same time. You're going to hear a lot of talk from me and from medical professionals over the next 2 months about this, so that we can keep up the progress that we've made in our public health condition, progress that is reflected, thankfully, in today's data. The county now estimates that the rate of transmission in LA County, or the R rate, is 0.95. Slightly higher than last week, but still indicates decreased infection rates from where we were this summer and below that magical threshold of 1, meaning that those numbers should continue to come down as long as somebody infected isn't spreading it to more than one person. As of today, 5 of the 6 critical indicators that we track, again, are headed in the right direction. And yesterday, the state again updated the tier status for each county. While LA County remains in the most restrictive tier, purple, there is some very positive news. That the metrics that are most important to the state, the case rate and the positivity rate, continue to improve here in Los Angeles. That means that if we keep this up, we may be permitted by the state to move into the next tier in the coming weeks and months. But here's the bottom line. We are slowly but surely moving in the right direction, and your actions have saved lives. But let's not confuse progress with promise. Positive trends don't mean that we're out of the woods by any stretch. The virus is still here, and we still have to act with vigilance. So, you know what to do. Keep avoiding those gatherings. We're waiting to see what the impact of Labor Day is, but knock on wood, it seemed much better out there than the previous holidays of the 4th of July and Memorial Day. Keep maintaining at least 6 feet of distance. Wash your hands and your surfaces. Wear a mask. Avoid crowds and conversations. And masks, we know, make a huge difference. Today, in fact, the director of the CDC said, and I quote, that masks are the most important, powerful public health tool we have. That wearing a face covering is more guaranteed to protect against COVID than a COVID vaccine, because a vaccine may not provoke an immune response for everybody. I'm very proud that LA was the first big city, widespread, to require masks. And Angelenos have embraced their importance in everyday life. And we must continue to encourage others to use this critical tool. Since July, almost 20,000 people have looked at the way we're using art to get this message out by visiting the website of our LA Mask Print Project that we started in July to amplify this message and to download prints from some of our greatest artists here in LA, art that shows the very best of our city's creativity and spirit. Tonight, we're releasing another poster. It's from Aaron Rodriguez, an artist and designer who's based in West Los Angeles. And you can download this for free at coronavirus.lacity.org/maskart. And businesses and residents are encouraged to post this in your windows and your shop doors alongside the other mask prints that are at the site. We have these for multiple neighborhoods too, so thank you so much to Aaron for your extraordinary work. Today in the county, we had reported 1,148 new infections, bringing the total to 256,148. 496 of those cases were here in the city of Los Angeles, bringing the city's total to 104,168 cases since March. The good news is our 7-day average since a week ago has now been under 1,000 for the first time since May 21st. That's a job well done, Los Angeles. That's a job you can be proud of. And let's keep those numbers coming down. The county, most tragically, and our hearts go out to everybody who has lost someone, reported 31 deaths. This brings the total of fallen Angelenos to 6,303 souls. Of these 31 deaths, 11 were in the city of Los Angeles. And we mourn with every family. I'm going to be sharing a story of one at the end of this presentation. Our hospital inventory, as I mentioned, remains stable and lower than we've seen. Across the county, there are 759 available beds, 593 of them for acute care and 166 in the ICU. And we have 1,243 available ventilators. We have 238 ICU patients who are severely sick. This is a substantial decrease since last month, and we pray for the recovery of each and every one of those, with the families that I know are hanging on every message they get from a doctor about their loved ones' conditions. Today, 780 Angelenos are in the hospital with COVID, which means we've cut that number of hospitalized patients nearly in half over the last 5 weeks. But even as we have these better numbers, these lowest levels since the start of the pandemic, yesterday we saw the first modest increase in hospitalizations in recent weeks. It came back down again today, but this is a fragile number. We can't be careful enough. If you feel there's even a slight chance that you have been exposed to COVID-19, please get tested right away. Ask your doctor for an appointment or schedule a test at one of the community health centers or a city, county, or state site. At our city sites this week, we have the capacity to test more than 20,000 people each and every day. And thank you to the volunteers who've been working in this heat, this record heat, to continue providing this service to all of their neighbors and fellow Angelenos. You're truly heroes. And as of today, 1.4 million people in our city have been tested, and our 7-day positivity rate is 4.59%, according to the state. The county is tracking that even lower, as low as 2.3% in recent days. We also continue to send mobile teams all around Los Angeles so that you don't have to come to us, but we come to you. These have been successful and popular, and we're going to keep going where the need is greatest. Today and tomorrow, we have mobile testing teams at East 60th and South Central Avenue and at San Fernando Recreation Park. And remember, these tests are free for anyone with or without symptoms. So to find any of these more than 100 testing locations, please go to our testing website at coronavirus.lacity.org/testing. And remember, if you get a call from a county contact tracing team member, answer that call. And please finish the interview. People's lives, including those you love most, depend on it. And you can also help stopping the spread of the virus by downloading the Citizen Safe Pass mobile app that we debuted last week. It notifies you if you've come into contact with someone who has tested positive for COVID-19, so you know when to get tested as well. The app is free and it's private and anonymous. Your data isn't stored with anybody in government, and every 2 weeks it's washed away. It puts the power in your hands to help trace outbreaks and to electronically slow the spread and stay safe. Over 1 million people already have the Citizen app here in LA County. If you haven't done it, join them and make sure that you have the Citizen Safe Pass. As the months wear on, I know that so many of us are impatient. I hope everybody is looking out for your mental and spiritual health in these difficult days, days where we have better numbers, but until those numbers are zero, each one represents human suffering and loss. Maybe you've started to make little changes. Maybe because of your impatience, you've started taking a little bit more risk. I get that instinct. I understand it. I know you want things to feel normal again. But when we loosen up, we see negative effects. Last Sunday, more than 7 in 10 new cases in LA were from people under 50 years old. So I want to talk to young Angelenos again about the importance of being vigilant. Today, the highest number of infections among people 30 to 49 years old is among people 30 to 49 years old. And the second highest is folks 18 to 29. That's a sign that the restlessness may be especially prevalent among younger Angelenos who have heard over and over again that they're safe from this virus. They don't have to worry, they won't die. But that isn't true. This virus can have a lasting effect. No one is immune from this virus, and more research is telling us how many young people and healthy people are being infected and how much they have to lose if they are. Even if this disease doesn't kill you, it can change your life forever. Research published in The Atlantic recently offers a powerful example. If a man in his 30s and a man in his 60s both contract COVID-19, it is more likely that the man in his 30s will develop a months-long illness than the 60-something will die. Hear that. It's more likely if you're in your 30s that you will have lasting, maybe even permanent effects than that 60-something-year-old will die. These so-called long haulers are experiencing long-term illnesses, not just a cough or a minor headache. We're talking about some really nasty stuff. Fevers that don't go away for weeks, hallucinations, memory loss, gynecological problems, erratic heartbeats. Up to 1 in 5 COVID patients have heart damage, and more than half of the people who don't even show symptoms develop lung abnormalities. And this is still a new virus that we're learning so much about, so we don't know the full scope of what it will do to your body. We don't know what other diseases it might open the door to and lead to, or make you more susceptible to. So each of us at every age, every stage of life, every walk of life, needs to remain vigilant to protect ourselves and our family from that long-term suffering. Across Los Angeles, this virus has altered lives and shattered the way we look at the future. Last night, this terrible disease took a beloved member of our Los Angeles city family, Daniel Salazar. Danny loved Los Angeles. He loved his family, and he loved what he did every single day, working at our Department of Recreation and Parks. As a kid growing up in Pacoima, Danny came to see the power of sports and recreation transform lives, to help young people stay away from gangs and keep them on a path to a promising future. He understood that when kids had a sense of purpose, when they had a community to call their own, that they could transform their lives and the life of their city. And that became the work of his life, and the mission that guided him every single day in his 27-year career. Danny threw himself into each and every role he was given, recruiting over 250 teens for an after-school program, Lanark Recreation Center in Canoga Park. And 15 years later, many of those participants have gone on to their own careers, now serving young people as rec and parks workers in our government. He helped rebuild a soccer and volleyball program in Van Nuys from the ground up, and as usual, he exceeded expectations, creating a program that served 300 youth. And at every stop along his journey, Danny brought his trademark sense of humor, a magnetic warmth, and a deep enthusiasm for his work. That's the spark that caught the attention of one of his fellow Rec and Parks workers, Ileana Ortega. And after a first successful date at a Dodger game, the two of them set out on a life filled with love, adventure, and family. A life tragically cut short by COVID-19. Wherever he went, Danny brought light, and he brought hope, and he brought opportunity to those who needed it most. That's the example that he and Ileana set for their three boys, Danny, Liam, and Nico. And it's what he gave to all of us as an angel in this city of angels. And to Ileana, and to Danny, and Liam, and Nico, we wrap our arms around you. Not just those of us in your city family, but 4 million grateful souls who know that Danny gave himself to all of us. Tonight, let's honor the memory of Danny Salazar. Let's honor the memory of each and every one of our loved ones whose lives have been changed and whose lives, in some cases, have been lost because of this fight. Let us remember those who are on the fire line right now. Continue to pray for the recovery of our two sheriff's deputies. Let us summon the things that bring us together and that recognize those who are angels in this city of angels. And know that those just aren't other people. They are you. You can spread your wings out each and every day when you wear a mask and keep your distance, when you donate to the food bank or volunteer. We had the 19th anniversary of 9/11 this past week. I went to the LA Regional Food Bank and saw the spirit of this city with volunteers wearing masks at a safe distance in the midst of a pandemic, packing up plums and produce to be able to get food to those in need. I saw, too, at a fire station, restaurants who themselves are threatened with going out of business, who have had to lay off employees, who still were making meals to deliver to fire stations to say thank you to firefighters, because we saw 19 years ago so many of them lose their lives, just as we see those who have lost their lives on the fire lines here in California. Let us carry forward that spirit of action and service and of love in everything that we do, and follow their example by protecting one another. And let's all stay safe and stay healthy, and whenever possible, stay at home. We can get through this together, and we will. So, sending you a lot of strength and a lot of love as always. Thank you, Los Angeles. With that, I'd be happy to answer questions, and then, as always, I'll give remarks in Spanish too. First question, please.
And the first question comes from the line of Claudia Pescuda with KNX News Radio. Please go ahead.
Good evening, Claudia.
Hi there. Good evening. I have a few questions. On Mr. Salazar, I'm wondering if he was potentially exposed to COVID while at work, whether he worked at any of the emergency shelters, and is he the fourth city employee that we know of who has died of COVID? My second question is, can we get an update on the plans to pilot paper strip testing, where and when that might begin? And then my third question is, we're starting to get information from the coroner's office about heat-related deaths of homeless people during the recent record-breaking heat wave. As far as I know, the city had only 6 cooling centers open, none in downtown. One of the heat-related deaths that weekend was a man who died on a sidewalk in downtown. Wondering why the city had so few cooling centers and why areas with large concentrations of homeless people went without cooling centers. And I have similar questions about smoke relief centers, which, as far as I know, there were just a few open, and that was just on Sunday, and obviously poor air quality continues to be an issue. Thank you.
Sure. Thank you. Let me see if I can hit everything. No, we don't know. The whole family was exposed and was positive to COVID, so we're not sure where the spread came from. I don't believe he had worked at one of the rec centers that had stood up a shelter, but I'll get back to you on that, but I'm sure we don't know. I believe we've had many more. We've had, this was the 12th city employee that has died, and that's a combination of folks that have been out there, some who have been at home working from home, but we've had 12 members of our city family die, unfortunately, because of COVID-19 so far. In terms of the paper strip testing, hope to announce some more about that in this coming week, but we've been working very closely with USC, with all of the different companies that provide paper strip testing. We discussed this with the Surgeon General and gave him a heads up and asked for federal assistance as well, and with Rockefeller Foundation, who is partially helping us fund this so that we can look at the accuracy and impact of the paper strip tests and also compare that to the traditional PCR test. So we feel confident that will, in this next month, we will move forward with that pilot, hopefully get the data quickly, and depending on what the manufacturing capacity is out there, if this is viable, be able to work with everybody from the school district, which has done a great job also standing up their testing protocols right now, and other places like work environments to look at that. So we'll announce a little bit more, I think, next week when we probably have the final screws on the design of the pilot will be. In terms of the heat, it's very difficult to get folks off the street. There is plenty of cooling centers that exist, cooling centers in the Missions and other places here downtown. So many of the providers, while the city didn't have to open up rec and parks, we have very few parks here close to where folks live that have indoor spaces. But there are those, and it is a challenge. But absolutely, anywhere that we can continue to do that, and I've asked when I heard about those deaths, an after-action report to say, what can we do to go above and beyond, even if it isn't a traditional rec center? Is there something else that we can do to offer cooling? And what sort of outreach is our Homeless Services Authority doing to make sure that people know? As I mentioned, that can be tough. A lot of people don't want to move, don't think they should, but wherever they can. We've done over 20,000 wellness checks, and I want to thank our LAHSA outreach workers, and with the heat, that's critically important as well. And same thing, I think, with the smoke ones. We've had plenty of capacity at the cooling centers, by the way, so when we looked at that, we always assess that. If they're filled up, then we open more, but there was plenty of space there, which indicated that people were finding some place to be that needed it. For folks that are living on the street, though, on those hottest of days, I think we have to double down that outreach because it is life-threatening to people, as we tragically saw. Thank you. Next question, please.
And the next question comes from the line of Robert Kovacic with NBC. Please go ahead.
Robert, good to hear your voice.
How are you, sir?
I'm okay. How you doing?
You too.
Good.
A couple of questions for you as well. Let's just start with the new metric that the state of California has added, the health equity. I'm wondering how you see that impacting Los Angeles and the plans for the county to reopen. Once the county does reopen, hopefully, as we heard today, at some point in October, if you could give us some specifics in terms of what you foresee actually reopening, because I think a lot of people are still confused as to what will be the next step.
Yeah.
And then finally, there's a concern from some people we talk to, specifically the mayor of Calabasas, who feels as if the decisions that are being made by county leaders are not taking enough consideration to a local voice. And she believes that her city, for example, has done very well, is ready to reopen quite a lot of things, and is wondering why exceptions shouldn't be made for certain cities that have sort of met different metrics and have done other things that right, and why they shouldn't be given some type of consideration in the larger picture.
Sure.
So those three.
Thank you. So let me start with the last one. Thank you, Robert, for those questions, because I know how confusing it can be for those of us that make public policy, let alone for everyday residents of California. The county decisions, I think now are being paced the right way. One of the things I've asked for from the governor is try to be as regional as possible, and I've asked county leaders to try to be as countywide, and for both to give us as much heads up as possible so that people don't have hours before investments are made on indoor dining that a closure comes, or vice versa, if we're preparing to reopen things, that people have time to prepare, invest, get ready for those. I'll say a couple things on principle. One is I think that the first priority must be, our youngest children right now, especially those in low-income areas who right now are facing, not just the threat of not learning in terms of their schooling, but also being in unsafe situations when their parents have to work and they can't be left alone. I think that should be what we're all gunning for, to make sure that we get to these thresholds so that schools in one form or another safely for our teachers and safely for our staff, as well as our students, at least for our youngest, K through, or pre-K really, through fifth grade. Students should get in there. The evidence shows they're least likely to spread. We have space for them, as we're showing in our own rec centers, where we're providing those programs, as we did throughout the summer, for young Angelinos, and Council President Nuri Martinez has worked very hard on for middle school students now in our rec centers. That should be our #1 priority. So there is no set list of what will open. These are decisions that the county has to weigh and make sure are done with the highest priorities. And to me, the highest priority is the equity of these young people who don't have a place to go right now, and no city or county program can make up for that. We just simply don't have the space, the personnel, or the experience, that we will try as hard as possible. In terms of the health equity stat, they're going to be adding this metric in the future about city tests. I think anything that brings equity into this is very important. I think we have a very good record when it comes to closing gaps, when it comes to equity in mind. I've mentioned many times here, for instance, we may be the only city in America, or one of the few cities in America, that's erased the African-American disparate deaths as a result of COVID to now under the population of African-Americans in our county. I'm very proud of that. We're focusing very much on the Latino community, where we have seen spread in our community consistently be above what the average is, in the Pacific Islander community and the Native American communities too. So anything that balances equity in there, I think, is good for us, because we're already working on that, and it also recognizes that it's tougher for certain places. Finally, I'm very sympathetic and understand my fellow mayor who's in Calabasas. We're actually lower in LA City usually now on cases and on deaths than our proportion of population in LA County. But I would just say this: if we open up kind of in a Swiss cheese way, people will still go to, there's no walls between our cities. People will go from one to the next. If a hair salon is closed in one city, but across the street it's open, or a gym, that spread will happen. So I think it is important, as frustrating as it is, for us to try to move as much as possible, always together. But I hope that our county leaders, who we've worked with so beautifully together, will really hear loud and clear, especially the need of those young people and women who are disproportionately. We could set back women's gains, one study showed, in terms of workplace pay by 20 years because of COVID-19, and the disparate impact on women of childcare. Women are losing their jobs disproportionately and their hours disproportionately because they have to care for young kids disproportionately, and I think we need to step up and help them. Thanks, Robert. All right, I'm looking over the board. I think that is the last question. And do you want to follow up, Robert? Sorry, I heard your voice.
Do you foresee it possibly delaying any type of progress that LA County could make, or do you believe that it will still be on schedule when you add this new metric in?
With the equity, it could work either way. But I hope that, look, one of the things I successfully talked to the governor about was LA is different than other places. We have a higher vulnerability index. And so, don't just look, for instance, and we've been quite successful with things like testing. So don't just look at the number of cases, because we had the most robust testing in the country for a long time, and we're probably top 2, top 3 cities in the country per capita in terms of the tests that we have. So they were able to look at things more like the positivity rate, look at the decline. And so I think as long as we have those in place, I do feel optimistic that we will be able to meet those thresholds. If we get our flu shots, if we keep wearing our masks, if we keep our distance, all of this is very fragile, but we're absolutely on the road to recovery. We've seen more dramatic drops in the last 4 or 5 weeks than we've seen since this thing started, thanks to everybody out there. Let's keep that going. Let's not get lazy. Let's not let it up. And I think the equity measures can probably help us as much as they may hurt us. And I think we will make that case to the state. Don't unfairly punish us for the progress that we've made, the tests that we have, et cetera. But I think we have some good measures to show. So I don't share that right now.
Hey, Mayor,
Yeah.
Can I follow up with one more thing?
Yeah, of course, no problem.
Well, we'll make it 2 more things. First of all, since we're going to go, I'm moving completely now into the gridiron. Will you be encouraging USC to take the field now that basically Governor Newsom said that it's not a problem as far as state guidelines are concerned? Are you going to be okay with the Pac-10 resuming? And with that said, could you indulge us, and would you like to say anything to Fred Rogan, who today is celebrating 40 years as our sports anchor at NBC?
40 years, that makes me feel old, but he still looks so young. Fred, you have been the guy I've turned to for sports my entire life, and what in the greatest sports town that there is. Congratulations, Fred, on 40 years serving the city. You have more championships than anybody who has worn a ring for the Lakers, Dodgers, or any other team that we have. Thank you for what you've given us in terms of joy. I'm glad there's games back, and we love you. And here's to another 40 years. I hope to be in my retirement home listening to Fred tell us what's going on. In terms of USC, I'll leave that to the Pac-12 and to schools like USC. Obviously, there are protocols that sports leagues have been able to show safely to be able to, with, of course, the audience and the fans not in those spaces, as we saw the Rams in their great victory at SoFi Stadium this weekend do. I know it seems weird to watch, but if they can figure out a safe way to do it, I wouldn't oppose that from Pac-12. But that's a decision they have to make collectively. And I would just say there's a lot at risk. We shouldn't have, if we learned one lesson from this summer, don't take one step forward and then think you can take two or three. If you figure out a safe way for the athletes to really stay contained and to really stay in a bubble and to really have those testing protocols, don't start creeping fans into it. We know that the spread can happen very quickly, and the fall is a high-risk environment, especially with the flu. So I'd also support Pac-12 saying, not this season, but I'll leave that up to those professionals looking at what they can do, just as I've trusted businesses and others to give us the feedback of where they think they can best protect people. I hope we continue to listen to those folks. It's great to have professional sports back, and I wouldn't oppose it if they decide it's safe. Thanks. All right. Okay, talk to you soon. Thank you, Robert. All right, I will switch over to Spanish. Thank you again to everybody listening in English, and don't forget to get that flu shot. Buenas tardes, Los Ángeles. Esta semana nuestra ciudad sigue enfrentando incendios en el estado y el condado que presentan riesgos de salud con la peor calidad de aire que hemos visto en 30 años. Estos son los impactos del cambio climático. Estamos trabajando sin parar para ofrecer alivio a quienes lo necesitan. Durante el fin de semana abrimos 4 centros de alivio del humo en la ciudad. Tenemos equipos de bomberos luchando contra el incendio Bobcat en el Bosque Nacional Ángeles, el cual ahora está contenido el 3%. Y desplegamos casi 100 bomberos para ofrecer apoyo luchando contra incendios en otras partes del estado. Seguimos también luchando contra el COVID-19. Para ayudar en este esfuerzo, su familia puede obtener la vacuna contra la gripe entre ahora y el final de noviembre en las farmacias CVS, Rite Aid y otros lugares ofreciendo la vacuna, incluyendo con su doctor. Los datos de hoy muestran que estamos progresando con nuestros esfuerzos para frenar el brote en Los Ángeles. El condado ahora estima que la tasa de infección está al punto 95, que sigue indicando una disminución de las tasas de infección. Estas son buenas noticias y gracias por su trabajo en este progreso. Hoy, 5 de los 6 indicadores que monitoreamos están progresando en la dirección correcta. Mientras el Estado determinó que Los Ángeles sigue en el nivel morado, el más restringido, seguimos mejorando en los parámetros más importantes, la tasa de casos y la de positividad. Sin embargo, el virus sigue aquí y no podemos pretender que se vaya a desaparecer. Debemos continuar a tomar acción con vigilancia, siga evitando reuniones y mantenga al menos 6 pies de distancia. Lávese sus manos y lleve una mascarilla, por favor. Desde que lanzamos el proyecto artístico de mascarillas LA en julio, casi 20,000 personas han visitado nuestra página web para bajar los diseños de artistas locales. Y esta noche relevamos otra obra diseñada por el artista y diseñador Aaron Rodriguez. Está aquí Y puede bajar este diseño en la página coronavirus.lacity.org/maskart para mostrarlo en sus ventanas. Gracias a Aaron por su diseño. Hoy en nuestro condado tuvimos 1,148 nuevas infecciones, lo que eleva el total a 256,148. Y 496 de los casos de hoy estaban en la ciudad de Los Ángeles, y lo que eleva el total de la ciudad a 104,168 casos desde marzo. El condado también reportó 31 fallecidos, trágicamente, lo que eleva el total a 6,303. De estos, 11 estaban en la ciudad de Los Ángeles. En los hospitales a través del condado hay 759 camas disponibles, incluyendo 593 camas de cuidados agudos y 166 camas en unidades de cuidado intensivo, y también un inventario de 1,243 ventiladores disponibles. Y tenemos 238 pacientes quienes están seriamente enfermos, una gran reducción del mes pasado, pero somos con todas las familias que tienen un miembro de la familia en estas camas ahora. Hoy en día, 780 angelinos están en el hospital con COVID, lo que significa que hemos reducido el número de pacientes hospitalizados casi por la mitad en las últimas 5 semanas. Pero ayer se produjo el primer aumento modesto de hospitalizaciones en las últimas semanas. Entonces, mantengan cuidado. Si piensa que ha estado expuesto al virus, hágase la prueba inmediatamente. En nuestros sitios de prueba, esta semana tenemos la capacidad de hacerle la prueba a más de 20,000 personas cada día. A partir de hoy, lo hemos hecho la prueba a más de 1.4 millones de personas en la ciudad y nuestra tasa de positividad es 4.59%. Seguimos enviando equipos móviles por todos Los Ángeles donde la necesidad es inmediata. Hoy y mañana tenemos equipos móviles de prueba en el calle 60 Este y el Sur Central, Avenida de Sur Centro, y en el Parque Recreativo de San Fernando, en el Valle de San Fernando. Recuerde, las pruebas son gratis para todos, con o sin síntomas. Visita nuestro sitio web para encontrar un sitio de pruebas a coronavirus.lacity.org/testing, o puede llamar 31. Si usted recibe una llamada de un miembro del equipo de rastreo de contactos del condado, tiene que contestar, por favor, y ayude a salvar vidas con descargar la aplicación de rastreo de contactos gratis SafePass en su teléfono inteligente. El domingo pasado, más de 7 de cada 10 nuevos casos en Los Ángeles se encontraron en personas menores de 50 años. Y el mayor número de nuestras infecciones en todos los grupos de edad se encuentra entre los residentes entre 30 y 49 años. Nadie es inmune a este virus. Una investigación reciente ofrece un ejemplo impactante, notando que es más probable que un hombre de 30 años con COVID-19 desarrolle una enfermedad que dura meses de que muera un hombre de 60 años. Cada uno de nosotros, de todas las edades, debemos permanecer cuidadosos y conscientes de los riesgos que corremos. Amigos, hermanos y hermanas, quédense protegidos. Quédense sanos y cuando puedan, quédense en casa. Muchísimas gracias por su trabajo. Y recuerdes todos los bomberos ahora que están luchando a proteger nuestro estado. Fuerza y amor, Los Ángeles. Y hasta pronto. Thanks very much.